Hey guys, it's Christina at Aqua Body Lab. I wanted to hop on and make a quick injection demonstration video. Just so you know, at the end I'll go over the tracking sheet, submitting for refills and all of that information. We'll also have a separate video where Holly talks about concentration of medication and the difference between the milligram dose and the units that you're drawing up for injections. So let's just hop right into it. You are going to be getting medication straight from pharmacy. It's going to ship directly to your home in a nice cooler package, so that is going to be kept cold for you. You will receive a tracking number to your email once pharmacy ships out medication. Just as a reminder, pharmacy processing times can vary. We've seen it everywhere from a couple of days to a week, 2 weeks if it's a holiday and there's a backlog. So just, be patient with us. Let us know if you have any concerns, but pharmacy will be processing those as quickly as possible. For the injection, they will send you everything that you need supply-wise. If for some reason you are shorted on syringes or any supplies, you can contact pharmacy and they'll send you more. You can also stop by the office and we can supply those as well. You will have a little Sharps container at home. If you do not get a Sharps container from the office, you can order them on Amazon. You can alternatively use something that is hard plastic, like an empty detergent bottle, to securely store Sharps. You don't want to throw Sharps away in the trash. You will be getting alcohol prep pads, syringes, and then your vial of medication. I don't have a vial of medication to share with you today on video, so I'm gonna be using a vial of a different medication that we have here at the office. This is much larger than what you're getting, and it's also clear. Your vial is darker, the medication is photosensitive, so it's gonna be smaller, it's gonna be darker, but for filming purposes, this is gonna work great. For injections, you want to make sure that you've gathered all of your supplies and that you've read the instructions on your prescription label thoroughly so you know what you're injecting. Just be prepared for that injection. First of all, we are going to prep our vial to pull medication out of it. You're going to take an alcohol prep pad. You're going to go ahead and wipe the top of your vial, and you're going to wipe wherever you're injecting as well. Injection sites, you can inject in the abdomen or outer upper thighs. I tend to say inject in the abdomen, a little bit easier to reach and see, a little less issues with injecting in the abdomen. You're going to be finding your belly button and you're going to be going 1 inch to 2 inches to the left or the right. For injection sites, we do want to rotate, so we're not injecting in the same place every time. We want to make sure we're injecting into healthy tissue, so no scarring, no bruising, no rashes, nothing like that. And you're going to be tracking that on your tracking sheet where you're doing those injections. So once you've wiped top of the vial and your injection site, you can go ahead and take out your syringe. For an example, we're just going to say that we're drawing up 50 units today. So all of the numbers that you're going to be paying attention to on your prescription label are units. You're going to be looking for what units you're drawing up, and then you're going to be looking on the syringe for units as well. If you can see here, I don't know if I can get this to focus. It's got a little ml on the bottom. Ignore that. That is not the side you were going with. You are looking for the spot that says units on the bottom there. So there are going to be caps on both ends of the needle. You're going to want to remove the cap from the plunger side first. I always leave that needle capped until I'm ready to go. We don't want to uncap that, leave it sitting anywhere. I'm going to show you too, a little close-up of the syringe. Again, got to make it focus here. You can see that little black part. You are looking for the top of that black plunger to be in line with the units that you're looking to draw up. So this is a 50 unit syringe. If I'm drawing up to 50 units, it's gonna be all the way down here. We want that top of the black plunger to be in line with that 50 units. These vials are pressure sealed. To break that pressure, you're going to draw up air in your syringe first, and you're going to inject that into the vial. It'll help keep the medication from being sucked back up into the vial, help you draw that back easier pretty much. So I've got this all prepped. I'm gonna go ahead and uncap my needle. There is a little gap in all of the vials where there is air at the top. You have to turn that vial upside down so that medication falls to where your needle can reach it. When you're injecting the needle into that vial, you want to do it straight on, not at any wonky angle. That's going to be when you bend or break that needle. Obviously, we do not want to inject with any bent needles. We never want to reuse needles either. So you will go ahead and inject air, and then you'll draw back to your desired dose. And Once you get that, go ahead and just pull straight out. Again, not at any angles. That's where you're gonna bend your needle. You'll use your non-dominant hand, I'm right-handed, to pinch a little bit of skin, and you're gonna inject needle in fully at a 90-degree angle. Go ahead and press that plunger in at a nice steady speed. Obviously, I'm not injecting this into myself right now. Inject it at a nice steady speed and then just slowly pull out. If there's a little bit of pinpoint bleeding, just use a little bit of tissue, hold for just a second, and that'll get that bleeding to stop. Again, you have your sharps container. Once you've injected, throw that needle straight in the sharps container. There is information on your tracking sheet about how to dispose of these in Ingham County and other counties as well. So let's hop on and talk about our tracking sheet. First page is always going to be the 2 different medications that we offer, the dosing and the pricing differences. Second page is going to be commonly asked questions. So things about nausea. If you're having nausea, we can send in a prescription for Zofran. That's an anti-nausea medication to your preferred pharmacy. It's going to talk about constipation. It's going to talk about a lot of other things in here. So great information on page 2. Again, if you have any questions, though, contact the office. We're happy to help. Page 3 is your semaglutide or tirzepatide diary. This is really important. We need this every time you ask for a refill of medication, and we need it completely filled out to be able to process that refill request in a timely manner. So on the left-hand side here, you're gonna put the date of your injection. Remember, these are once weekly injections if you're not on maintenance dosing. You're gonna give it the same day every week. So if you do it on Friday the first week, you're gonna do it Friday of every week. If for some reason your injection schedule is gonna be off, just contact us. We'll let you know how to proceed. You're gonna see units injected in that next column. It is highlighted in red because, again, this is the amount of liquid that you're drawing up and injecting. This is what you're looking for on your prescription label. Third column here is going to be dose in milligram. That dosing scale never changes even when the concentration does, but we do want you to know the difference between the units that you're injecting and your dose. Location of injection, so reminder, switching injection sites. You do it on the left abdomen 1 week, do it on the right the next. You'll be recording your weight at home. You do have to have a scale at home to be able to record this for us. And then symptoms. So nausea, constipation, anything else that you're seeing, let us know. If you're not having any symptoms, you can leave it blank or write in a little NA for us. There is a questionnaire on the right-hand side as well. It's gonna ask, are you losing weight? Are you tolerating your current dose? Meaning, are you having minimal side effects? And number 3, are you hoping to increase your dose? All of this information is really helpful for us to be able to quick send out that refill. There is information highlighted in blue as well that's pretty important. So keep refrigerated. You're gonna be on each dose for a minimum of 4 weeks before considering increasing or decreasing. There's information about that on the bottom. There's information about that on your prescription label. And again, if there's questions, you contact the office. Just a reminder that the goal is to lose 1 to 2 pounds a week. That is considered successful weight loss. And then it's gonna give you the number that you will text an image of this into. It's a secure line with our EMR system. So I think that covers the basics of it. Again, like I've said multiple times, call us if you have any questions. We are here to help, here to support you in your journey. Thanks so much.